clean with me while I tell you a little bit about our journey and my daughter's journey so far with her treatments, and sort of talk about the things that have gone wrong or delayed so far on her treatment or her chemotherapy with leukemia. My daughter is 14 years old. She got diagnosed with leukemia back in June 27 of 2025. Some of the symptoms that she experienced early on, it was just being really tired, nauseous, had a little bit of diarrhea. Being nauseous and diarrhea went away, except the fact that she was just really exhausted all the time. She started developing some jaundice on her eyes and stuff, and that's when they ordered lab work with her pediatrician, and we had to get sent to the ER due to how her blood levels looked. And that was like a Friday afternoon that she got admitted to the ER. That same evening, they told us that it could be leukemia, but they weren't 100% sure, that they were going to run a couple more tests. The oncologist met with us that same Saturday and Sunday. By Monday, we already had a meeting, and she had a port inserted to her upper chest, kind of like her left shoulder. So that's where they would access her to give her chemo or to get any blood drawn, anything that she needed to get done. It would be through her port. So she had a surgery where they inserted the port, and she was using it fine for about a month or so until we had some complications. The scarring tissue came off due to one of the nurses in one of her procedures was cleaning it a little bit rough, and the scar tissue came off, and you could see like a little hole. That little hole started leaking. So due to that, the surgeon and her oncologist would not allow the nurses to access her until it completely heals. So right now she's still going through that process of healing. Thank God the little hole has closed completely now. Now we're just waiting for that to heal good and everything before they start using her port again. Now, obviously, they were not going to pause her chemotherapy sessions due to this complication. What they did is they had a pig line insert to her. So it's kind of like an IB where they insert like a line through one of her veins on her arm, and it goes all the way to her heart, just like the port does. And for the last couple of weeks, that's what they've been using to draw blood, to give her IB, to give her chemotherapy and things of that nature. It has been through that pig line, and that also has to be like cleaned out, flushed out, taken care of, and stuff like that. So right now she has like 2 things in her body that needs to be really well taken care of. So anytime she showers, I make sure I cover her port site that is on her chest, and also I make sure that I cover her arms so that her dressing doesn't get wet or anything. So we have to cover that really well in order for her to be able to shower. She can't get it wet. The whole thing with the leukemia is that it's directly correlated to her cells and her blood cells and her immunization and her ability to fight infections and things of that nature. So we have to be extremely careful with how we take care of those areas where she has an incision. And one of the other things that she experienced while she was admitted at the hospital is that she developed an allergic reaction to platelets. That's sort of just like a blood liquid that is inserted when they need it. Her platelets were really low when she was at the hospital, so they had to do like many transfusions. And during one of those transfusions, she developed an allergic reaction. So now anytime she needs a transfusion, they have to give her medications and sort of like prepare her before they do that. And another thing that they have to do every week on her is an LP, a lumbar puncture. That is just where they just access her spine, remove some liquid, and insert some chemo into her spine. Now, at the beginning of the process, she was doing just fine. They were able to access her and be able to get that done in like less than 30 minutes. But as time went by, it got harder for the doctors to be able to access the liquid on her spine. So now every time they have to do her lumbar puncture, they have to use an x-ray. So she has to go to imaging every time for that appointment when she's going to have her lumbar puncture. She goes to imaging. They use x-ray to kind of be able to see where they're going to be inserting the needle for the lumbar puncture, and that way they're not like bruising her or hurting her during this process. That's all those things that I have mentioned have sort of delayed her treatment in a way. So for instance, a lumbar puncture, a couple of times they couldn't get access to it, so then they decided to move her to imaging and to be able to do that. So now every week that she has a lumbar puncture, she has to go to a different department. And also with the fact that there was an issue with her port, now they had to stop using the port, and they are still kind of on the fence about the port. They're thinking that they may need to remove it if it doesn't heal completely or if it still causes any issues in the future. But we're hoping it heals itself and they can go back to use it, just because her having the pig line on her arm is a little bit uncomfortable because she can't really use her arm normally. She has it on her left arm. Normally they insert it through the right arm, but they just couldn't find the vein that was like big enough or good enough for the line to travel through, so they had to do it on her left arm. So right now, even when she sleeps, she can't really sleep on her left side because she has the port, she has the pig line, and so she always has to sleep on her right side and stuff. So, those are just a few little things. Also, with the pig line, she always has like a little tail hanging, so she can't really be like moving normally because we are afraid that it could get stuck onto something. So she has to be extra careful with anything that she does, any movement that she does, or even when she's trying to get comfy in bed, just to be careful not to pull on the pig line and things of that nature. So it's very uncomfortable to have the pig line and also have the port that we are trying to watch to heal. So those are like some of the complications or some of the like setbacks that she has experienced so far. And one thing that has become recent or barely new to us is that she's feeling a little weak lately. She's feeling like sometimes she loses her balance and stuff. We talked about this with the doctor, and he mentioned we'll just keep an eye on that just to kind of see how she's doing. She may need physical therapy, and sometimes it gets to a point where they need a walker and things of that nature. So those are just some things that have come up due to the complications and the different things that she has experienced, and also kind of mood wise and in terms of like emotions. I know she is going through a lot. I can't really comprehend everything that she's going through because I've never been in her shoes. But another thing that we thought would be really helpful is also receiving therapy, just because she's going to be needing someone to talk to. I know I'm here for her, and I know she has her grandma, she has family along and friends around her that, we're here if she wants to talk. But at the same time, I know sometimes it's hard to let out everything that you have in your chest because you don't want to worry your loved ones. So I think that's why we found it like really helpful that to have a therapist talk to her, so just so that she has access to someone where she can vent a little bit and just kind of let things out of her chest. But yeah, I know with so far, I can't say it has been easy, and I won't say it has been extremely hard either, because I feel like our main priority right now is just her well-being and her going through this process and trying to make it as easy as we can, as comfortable as possible as we can. As her family, we are doing the best that we can, and that in itself can also be hard sometimes. I do have a 6-month-old baby and also a 5-year-old, so it's kind of hard to divide time between all of them and just kind of being able to take care of things around the house too and stuff like that. So that part I think is like the hardest, just being able to not be able to take care of everything and everyone at once. That is just the most challenging part. And I will say I'm also doing the best that I can to take care of myself. I will start sharing some things that I'm doing for me, just to kind of share and creating awareness that, when a loved one is sick with a chronic illness, it doesn't necessarily just affect the person that is sick, but also everyone around, the whole family. And so I'm just going to go through some things that I'm doing for me personally, and some of the things I'm doing for my other kids and my spouse, to just kind of make things a little bit easier, because it's hard. All of us are going through a really hard situation right now, and it is not easy. So my heart goes to everyone who has a loved one with a chronic illness or has gone through a similar experience. My heart goes to you, and just have faith, pray,